Sealy, how's it going today?
It's great, Christian. It's great. Just loving it here. Trying to get
Awesome.
the last bit of ski days in,
Oh
I should
yeah,
say.
and you're out there in beautiful Aspen, Colorado, huh?
Yeah. It's nice. It's like spring weather. It's good.
Awesome. Yeah, I see the leaves on the trees in the background. That looks very beautiful. Well,
Yeah.
welcome everyone who's watching this audience with this episode of The Executive Edge. We are here with Dr. Sealy Hambright of Bay State Longevity out in the beautiful Aspen, Colorado. In Bay State, you guys focus on helping people improve your health, performance, and quality of life through a more intentional, science-backed approach. Um,
Yeah.
Dr. Hambright, introduce yourself. Tell us, who you are and kind of what you guys do.
Yeah, sure. Well, at Bay State, I would say we really rely on a variety of holistic practices, but interventional style management of these practices for our patients. So we have private sauna and cold plunge rooms for that type of therapy. We have like a red light therapy bed. We have an HBOT chamber, which is a hyperbaric oxygen therapy chamber, which is great. We do massage and we have like a lymphatic drainage system or lymphatic massage system, I should say. So really we have, I think, a really nice center that kind of has complementary holistic interventions that work great kind of when used together. They're very synergistic. And so we can build programs around those kind of interventions or therapies for our patients. And then we throw some science in the background too, where we can get some baseline physiological data from our clients and they join these programs. And then we can kind of walk them through protocols to help them optimize various physiological targets based on their goals. It could be weight loss or more performance, um, or just more general wellness, some cognitive improvement, etc. Because we do brain scans as well. But yeah, so like I think we have kind of a one-stop shop for Aspen, I would say, for these styles of interventions. But I think what makes us somewhat unique is a very evidence-backed or science-backed, protocol-driven approach that's personalized to the client, very programmatic. I like to say it's akin to a clinical trial. So when you do a clinical trial or a clinical study, you have kind of a baseline, snapshot of where the patient stands, and you have over time different what you call interventions or different kinds of therapies, perhaps. And also throughout the process of this longitudinal assessment, you have what we call outcome measures, which are just ways to track progress, basically. So you can measure blood, or you can measure like your epigenetic profile, for example. You can measure cellular kind of phenotypes from your blood, just to get a better idea if these things are working. And we pair that with symptomology or kind of how the patient feels. And so we can kind of, again, over time in a fairly robust way, kind of align like how they're feeling, what their performance is looking like if they care about that, with some good physiological data, all on site here.
Awesome, awesome. Tell us a little bit about, who your client is, right? Is it really just anyone, right? Any human
Yeah.
being wants to be more healthy, or is there a more segmented approach, like maybe younger people who want to live a long life, older people who want to continue their life? Like what's kind of that target market there? And also how did you get here, right? You are an extremely accomplished individual, and right, what kind of did that trajectory look like to you co-founding this company?
Oh, sure. Yeah, I can answer that first. I mean, I think we all have kind of unique journeys, obviously, especially in this entrepreneurial space. We all have come from diverse areas and have different motivations. But I'm a scientist by training. I was an academic for a while, did the typical things, and I was what's called a principal investigator. So I was an independent investigator scientist in an academic setting, kind of, and I wrote grants and manuscripts. But what I was doing at a clinic before I founded Bay State or co-founded Bay State was really trying to apply like the science of aging to different diagnostic tests to and to different therapies. We used a lot of biologics, a lot of stem cell therapies in the clinic I worked at. I worked at the Stedman Clinic in Vail, Colorado. And what I was finding is we could really do some simple things to improve either efficacy of that therapy in humans or in what we call preclinical studies where we use like mice and rats and stuff. And we could also do some simple tests to kind of like pair with those good outcomes, like I was saying. We actually patented a blood test that I developed there and stuff. So long story short, the central ethos or like my ideals in this space are that there's a lot of things we could democratize that could really get to the patients that we weren't really doing. Science takes a long time. And what I was finding is people just weren't really knowledgeable in this space, but there was really a thirst, if you will, for some of these interventions, and some of these techniques and tools. And obviously, I think I'm a little more entrepreneurially minded, which is neither good nor bad. There's pros and cons to that. So I was like, why don't we try to apply some of these concepts again, like a clinical trial, like I mentioned earlier, and track individuals programmatically and try to apply some of these newer tools and really kind of build out holistic programs that seem to be really working. And so I stepped away from that and started this here. And I've actually co-founded a few companies in this space. It's been a really fun and wild journey. But yeah, that was the central theme, was like democratizing what I'm learning, in the science lab, if you will, that works really well, that's safe and compliant. Let's get this out there. There's commercial value to that, sure, but it's also working pretty well and it's pretty easy. Sometimes it's pretty cheap. So anyway, yeah, that's the backstory. But yeah, I mean, I think it's been working pretty well. I mean, there's a lot of hurdles when you start a company, just with starting from scratch. We have a great team here. It's definitely not all me, not even close to all me. But you're doing everything from picking out the carpet color, if you will, to the programs you want to run on site. And you asked also in this question, like, what's our typical client, which is a great question. I think as a business owner, you always have to think about these things. What's your target audience? What's your target market? Obviously, addressable markets, etc. I'd never thought like that. I was new. We all were. But the real answer we've learned now is there's several addressable client types. I think the market's pretty simple. This is kind of like the wellness longevity market. That's kind of a vague term. But it's interesting because we thought we'd have specific people that would care about longevity or wellness programs, and they would probably typically be a little bit older, trying to just increase their what we call health span. Just live longer, healthier. People start to think about their health a little bit later in life, historically. I will say that trend is really changing, and what we found is that we have people interested in programmatic medicine approaches or programmatic therapy approaches at various different stages of life for different reasons. So we actually have lots of clients. So we'll service the younger person like you that's fairly fit, that just wants to optimize or wants to just do preventative things that make themselves live again longer and healthier. We have the typical or prototype of a biohacker, if you will, that'll come in. It's like, hey, I'm taking NAD and NR oral, but NAD infusion. I'm taking this senolytic. What can I do to improve the efficacy of those in combination, et cetera? And they're really interested in these programmatic approaches. And of course, we have the older individuals too that are, I just turned 50. I'm not, my knee hurts when I'm playing golf. I think I'm a little inflamed. What can I do besides taking prescription meds, for example, to kind of reduce these signatures, reduce these symptoms? And also with our brain scans, we can actually track, EEG signatures as well, and track kind of cognitive performance as a proxy too. So we really kind of hit all nodes, male, female, fairly young, and then obviously the older demographic. And so again, perfect example of, you go into a new business thinking what you're going to do, and then it changes, obviously. We thought it'd be we were a longevity center. We thought it'd be focused on, slightly older individuals. No, we get all age ranges with all different interests. So it's been fun for sure. Yeah.
That's awesome. That's awesome. And
Yeah.
one thing I noticed as well, like we were talking off camera, I went to see you Boulder, and you're in Aspen.
Yeah.
With being in Aspen, I mean, Colorado is very health conscious just as an area, like the people there, because they're outside a lot. So to your point of kind of, you know, dealing with people of all different, young, old, whatever, it's really a larger audience, I guess you could say.
That's a great point. So we also thought, again, you're wrong so much when you start businesses, but We thought, we knew that what you just said is certainly true. Like this is a very health conscious community. I mean, Colorado kind of as a whole is, but certainly Aspen, Boulder is too. Very health conscious, very active community. So part of our thinking was, maybe this is not going to be as appealing here because people are just generally more health conscious. They're more informed, just generally, to be honest, and they're very active. They might not need a whole lot. That was the opposite. The opposite actually happened because these people are so health conscious and so active. They're always looking for ways to improve. So they want to augment what they're already doing. And so they're actually a great client because they're fairly informed. They trust the experts and they rely on experts, and oftentimes just want someone to kind of to hold their hand or tell them how they should be doing X, Y, or Z. It's a very concierge medicine like approach. Um, but so I thought we might miss that market, if you will. But the opposite kind of happened. These are people that really love to use our facilities for one, because again, our therapies are fairly holistic, and certainly move the needle for people that are already fairly active and healthy. And also I will say a lot of these things in the holistic medicine space are these kind of simple interventions or kind of the simple intramuscular or IV therapies. Uh, these work the best with someone that already has a baseline of being fairly healthy and active, because these are optimization tools, right? So you're really going to boost like an extra 8% to your quote unquote performance or feeling, et cetera. So if you're taking methylene blue or NAD or NR, or you're using these therapies, that won't work if you're overweight, you're type 2 diabetic, you're not moving. Those are more major issues. So a lot of these, the application of a lot of our tools, if you will, actually works much better in someone that's already fairly active and healthy. Then we can really add that 10% or 15%. So yeah, that we actually were surprised that the appeal level was there for those individuals you're talking about. I'm glad it's there, but we're a little surprised. And I think it's also a perfect demographic to really to practice with these tools, honestly. Like I also work in the stem cell space, right? So I started a biologics clinic. We do biologic based therapies, and I did that as a academic as well. And we also found that the younger, healthier, active population really responds best to those as well. Because when you get autologous stem cells or autologous biologic products, these are products that come from you and use as treatment for you, like in your knee joint or something. It works much better if you're healthier and younger and active. So this is just a great demographic to I think work with programmatically, where you really want to see these deltas or these changes. They're really responsive. So yeah, it's been great. We were surprised by that. The active community is also active in this holistic wellness space and longevity space, believe it or not.
Yeah, that's awesome. And I guess there's a reason why they're already kind of healthy, right? Because like, they
Yeah,
have that open mind. They look for
yeah,
the solutions, right? Or the ways to get better, and they're open to listening to the expert because they understand that even if they did the bottom 70% on their own, that top 30% is a lot harder to hit.
you're exactly right. You're exactly right. And what they really need help with, and I'm generalizing here, but what I see a lot is that they want help sifting through the noise. There's almost like too much information available now. What's real, what's not, what's evidence based, what's not, what's snake oil, what's not. And so there's oftentimes just an educational element, which is really fun. I love that. And then they're also very compliant, like patients. So they'll go through, we can track them, we'll do things on time. So yeah, we were, from a commercial perspective, if you will, we were surprised that was a demographic that had that much interest and were that involved. We thought we might miss that demographic, but surprisingly no.
Awesome. Yeah, and I guess getting into the nuts and bolts of things a little bit, what do most people misunderstand about longevity, performance, aging well, and what are some data points that people should focus on, just within themselves, right? For somebody that's listening, what's out there that's misunderstood, and what kind of things should people be keeping a little bit better tabs on or track of,
Sure,
if they
sure.
can just do it themselves, even.
Absolutely. And because that's kind of our ethos, right? We want to democratize these things and then have these things available. And then we don't really care if they come from us per se, but we're just trying to spread the gospel, if you will. So the most common thing I think that happens with people that are, which is use the longevity space as a general term, the most common things they run into is people think there's singular solutions or some new wave thing that by itself in a vacuum will work well. I can give tons of examples of this, but people will get really hyper focused on one thing that they just happen to see on TikTok or happen to hear from a friend, whether it's a really specific peptide that's in the zeitgeist, like BPC 157 is going to cure all my ails. Definitely not at all, actually. Or red light therapy has been a big thing recently. I'm sure you've seen it too. There's actually a lot of evidence behind the effects of red light on cells and tissues. But there's lots of caveats to that. So people will just go buy the mask on Amazon to put on their face, or they want to go in the red light bed and think that's going to be the solution to everything. I think their mitochondria are going to be like supercharged now, and then everything's going to be fixed. So there's two things that are really important elements of what I just said for this overarching phenomenon of finding singular things to fix big combinatorial problems. One is that it's a multi-hit approach to do this. There's different hallmarks of aging. You want to target as many of those as possible. The red light therapy, for example, would in theory target mitochondria. Mitochondrial dysfunction is one of those hallmarks, for example. So doing things in combination is the way to go. We could talk about that, but in general, the general statement, you want to hit different nodes of cellular and physiological aging. That's really the way to attack it. And the other thing, this happens a lot, and this applies to various different interventions or therapies, and that is the sourcing. This is kind of boring of an answer, but I will say people will find the right interesting therapy to add to their stack, if you will, but they're getting it from the wrong place. An obvious example is like this new trend with peptide therapy. People are like, I saw this stack of peptides that will, agonize my growth hormone, help me get gains in the gym, or help my skin look better. This is great. That's true and generally as in principle, but they're getting those drugs from a bad source that's like research grade or not made and with good practices, or from a bad pharmacy, or from out of the country. So it's like not safe. We don't obviously sell those. And so what I'm seeing is they're making mistakes on the sourcing. And the same thing with the red light example. They'll see the red light. There's some decent science behind that. It is pretty good and cheap. It's good for especially for dermatological tissues. It's not a bad practice, but they'll buy a cheap version of that on Amazon or something. It doesn't have the energy behind the light, which is important, or the wavelength that you really want for that light, or it doesn't encompass various different wavelengths. So it's a little, esoteric, but we're seeing people that are on the right path, but just need help understanding which vendors to choose or where to source it from, and more importantly, how to stack it with other things. Because again, if you want to combat aging, generally speaking, you're going to want to hit multiple nodes that are driving aging and then are driving the age-related symptomology that we all care about, like cognitive decline, or the incidence rate of cancer, or joint pain, all these things, right? Those are
Yeah,
general concepts. I don't know if you want a specific or the general kind of trends, because
yeah, no,
that's
that's
what I'm saying.
perfect.
Yeah.
I mean, that was kind of answered my next question too. Like, what are some of the biggest mistakes people and high performers make when it comes to health? And I think you just answered it, right?
Yeah.
Frankly, they're cheaping out, right? Everyone wants,
Yeah. And
the
so,
newest iPhone and
yeah.
technology and stuff. But when it comes to your health, the single most important thing in your life, your body is your temple. They'll say,
Yeah.
okay, let's just do it this way because it's cheaper.
Yeah. Yeah. We see that the most by far. It's just the sourcing. Again, it's the sourcing of maybe that even for the H-spot chamber, there's different types of H-spot chambers, right? So like you want to make sure the specs are what you like, et cetera. And so that's a big one. And but the overarching theme is you want to hit multiple nodes. You want to do things combinatorially. So I've done a lot of research and published, looking at senolytics in humans and in rats, and mice, all that kind of stuff, right? Senolytics are just drugs that target a cell that starts to crop up as you get older. These are called senescent cells. It's very much in the zeitgeist right now, but that's not the only answer. And there's different types of senolytics. There's different dosing, and you want to use them in combination. And so like we see that a lot. So they're on they're on the right trail. They're on the scent, if you will, but it's not. They just need a little bit of help plugging, filling in the blanks and filling out a protocol to utilize these effectively.
Sure, sure. Let's change channels a little bit here and talk about Bay State, right? The business side of things. Where are you guys at right now? What's your focus right now for the business? What are maybe some growth challenges you're facing, or
Yeah.
what are you focused on now when it comes to building the business, optimizing, and kind of getting in front of more people?
Yeah, I would say the answer is it's a very exciting time. We're kind of at an inflection point. So, when you first start a business, you obviously have all the things you want to do, but you want to start small and roll them out, and you have to have all the lessons that you need to learn. And so we've kind of hit that point where we're established here, been here about 2.5 years, really, with all our offerings. I would say we're kind of rooted in the community in many ways, which is really nice to see. And now it's like, what do we do next? Like, how do we grow these programs? How do we grow what we can offer? How do we, expand our clients and expand our business, et cetera? And so that's where we're at now. And so I think we've certainly generally maximized what we can offer on site here in Aspen, just literally due to square footage, and what we can do there. Again, a lot of lessons learned. So now we're thinking about the next site, if you will. Our model is a unit economic model. We want to have a place here and then, copy and paste what's working well in different sites or areas, where we can again emulate kind of what we're doing here and rely on our brand identity that's back here in Aspen, which is kind of home. So that's what we're talking about now. And so like it's scary, but it's exciting. So we're in that potential growth phase. We're like, this is looking pretty good. Let's think about site two. And as you can imagine, with that growth, it comes capitalization to do that, the demography we're looking for, and market research for the different sites, and we're doing that now. So it's really fun. And then again, speaking about the build out and thinking about what we're going to offer at those places. Every place is a little bit different. So size matters too. So how much room do you get, et cetera? Do you go big, go small? So yeah, the position we're at now is thinking about site two. And because we feel like this site one here is fairly well oiled.
The second location is kind of what's next.
Yeah, the planning for that location, which is
Okay.
again exciting, fun, but also scary. And there's a typical business elements that accompany that. Again, like with capitalization, growth, that we bring in some aid there. I wouldn't say we have some exit strategy in mind per se, like I do with other companies, but because this is more of an organic kind of growth thing for us. But we feel fairly established here in Aspen, kind of optimized how these offerings work, and how to operate here, especially with the seasonality. And so now it's obviously the thoughts are on the site too, leveraging the Aspen kind of brand cachet for sure.
Sure. And just like you said before, when we were starting out here, it's just part of entrepreneurship, right? There's no perfect formula. You just gotta jump and build the wings on the way down. And the good part here is you now have the proof of concept and you have kind of the general outline. So you can take
Yep.
that and mirror it as closely as you can as possible for the
Yep.
next spaces. So when it comes to that expansion, what are the steps that you're currently taking? Are you looking for locations? Are you looking for partners? Are you looking for branding? What's kind of, in the crosshairs of Bay State to get to that next level?
Right. Yeah. I think everything you just mentioned is certainly on the list. I mean, branding, I think we're actually pretty good. Marketing, we need to earmark some stuff for local marketing and kind of expanding in that arena for sure. That's kind of normal. But the partnership is a big one, and site location, which sometimes is dictated by partnership, as you can imagine. Um, and so like partners would include like literally like partners in the venture, like, or some kind of service provider or existing clinic that might like what we're doing. But it could also mean, and obviously investors or people that come in to be part of, under our umbrella, that want to support, and help grow this. I mean, it takes capital to make these steps, obviously. And so I, I think the economics are probably the most important focus at the moment, as you can imagine. We have some ideas on site. Ideas, I mean, kind of vague ideas, certain site locations. Like Denver is a primary spot. And so like trying to outline the economics of a new investor, what that level is. We have some ideas, what we might need. We obviously can speak to that, but it's always a give and take of, bringing someone in new, you want to take the least amount possible. and you're going to bring in, another group or team or person to help you, but you need it. So it's like, what's the give and take? I mean, how much is really needed? What'll really boost the signal the most? Capital solves a lot of problems, but but the more capital you bring in, the more of your company you're obviously giving away, or the more decision making you
Sure.
might be giving away. I mean, these are just the common things one's going through at this phase. I think the exciting part is that we can grow. And I'm sure you can appreciate that, like, just getting to that point is like an exhale moment. Okay, like we could
Yeah.
do this for a while. It's fairly stable. Let's think about that next step. And so our cadence is a little bit more, it's a little bit slower, I guess, but it's a little more thoughtful versus other companies I've worked with, but in a good way, where it's like, okay, let's really make sure this is well oiled. Now let's do site two. So instead of like a thinking of site 3 and 4, it's like, let's really put a lot of effort into what this second site looks like, and is obviously in the most non-dilutive way we can,
Hmm.
which I think you can appreciate. But
Got it. Yeah.
yeah,
And a couple last questions here before we wrap up. Now, with that second site, um, are you thinking, it has to be the brick and mortar? Are you offering any type of online or virtual services with that?
it's a great question. So I actually started a new company just to address that problem, the virtual health issue. It's called Frame Longevity. We've launched for friends and family at the moment. We're going to launch the website this week, and then obviously take, de novo customers. But that this is not Bay State, but we'll work with Bay State a little bit. Bay State's really focused on the on-site, kind of clinic offerings, holistic therapy offerings. This telemedicine company really bridges that gap, but we really want to expand it out to all the U.S. and we have greater ambitions to have regenerative medicine or stem cell like clinics in different areas of the country where the compliance landscape is favorable to do interesting things in that space. And so virtual health is certainly the future of medicine, generally speaking, in many ways. There's a lot of tools you can use to not only communicate with patients and provide good care and manage medicine, but also get a variety of different tests sent to their home, and get a lot of blood work virtually as well, or sent out to where they're at, and really just provide medicine at a distance, but in a
Sure.
really informed and organized way. And so Frame Longevity actually does that. So a big part of my focus and my team's focus, not so much Bay State, but certainly is to work with people like Bay State, my other company, but to provide these services to really retain clients and customers. Again, Aspen's transient, right? So one of the
Hmm.
issues that you can imagine popped up pretty early was like, we have these really great clients or really great patients that really enjoy their experience here and like these services, but then they leave. So how do
Yeah.
we retain that relationship? I'm sure they'll come back when they visit Aspen again, but how do we retain that relationship and honestly just improve their care, because we can have a continuity of care with them? The only way to do that is through a virtual platform. And so these exist. We've made our own. It looks really great. We think it does, obviously. And so that's one of the gaps we certainly are filling at the moment as we speak.
That's awesome. Yeah, that's really great. And to your
Yeah.
point of growth, once that gets off the ground, the sky is really the limit because you don't have to get another location, right?
Yeah.
It's all in the infrastructure, so to speak.
Yeah. Yeah.
So to finish up here, Celie, what would you any last words? What do you want people to take away from this session? What are some things maybe we missed out on, or anything you want to get out there that you weren't able to say? And lastly, also, where can people find you? Where can people find more about what you do and learn more about you, and stay in touch, so to speak, if they want to be a part of this journey?
Yeah. Yeah. I think don't be afraid to ask or get some help. I think sometimes, again, what I'm finding the most rewarding and impactful is helping clients reduce the noise and increase the signal. So digging through all this information that's out there. Um, uh, I think people do a great job of getting mostly there, but have a lot of questions. And I think our happiest clients are the ones that came in with a few ideas and directions they wanted to go in. And it's like, you're on the right track. Let me tell you how to do it perfectly. And they love that. They respond well to it. and they see the best results from it. So get some expert care added on for you. It's not that expensive to do, in my humble opinion. And you can find me at baystatelongevity.com, framelongevity.com. Like I said, we're launching this telemedicine service. We'll have a variety of different peptide therapies and off-label drug therapies, longevity and wellness therapies. We have a whole list. We do a lot of testing at home, including blood testing, etc. And we'll soon have regenerative medicine clinics, hopefully in Florida. But yeah, that's where you'll find me, and on LinkedIn.
Awesome. Well, I really appreciate you joining us here today, and I look forward to getting this episode out there and hoping more people learn more about longevity and health
Yeah.
I think I think we touched on this. It's kind of getting younger and younger as time goes on because more and more people are being, you know,
Yeah.
exposed to the benefits and lack thereof if you just ignore it. So
Right.
this is a very important episode, and I'm glad to have you on. I'm honored, and we will stay in touch. And if anyone wants to learn more about you, they can go to your website, they can go to your LinkedIn, and hopefully work with you guys in the future.
Yeah, I really appreciate it, Christian. Thank you.
Yeah, no problem. Until next time, Silly.
Okay, we'll see you. Have a good day.